Misinformation, a recent major problem facing us all, and one that is pervasive in many realms, including medicine and healthcare, which are, of course, favorite realms around here. But wait, is all this stuff recent? Is misinformation a new phenomenon in the world of medicine and health, or does it have a history? The answer to that, thanks in part to funding from the NIHCM, is the topic of this week's Healthcare Triage. There's a lot going on at the junction of health and misinformation. Before we visit that junction, let's nod to the fact that there's a difference between misinformation and disinformation. Misinformation is simply a case of false or inaccurate information. Disinformation is also that, except that it's created and spread intentionally. To keep things less complicated, we're only going to use the term misinformation in this video. So back to that junction of health and misinformation. It seems that alarmingly false theories about things like vaccines and fluoride have been creeping up in what we might consider relatively recent history. But is that true? Is something like anti-vaccine sentiment a new phenomenon for humankind? Actually, no. Misinformation, both in general and specific to health, is far older than you might expect, has long used the same tricks to gather believers, and has always been pretty hard to beat back. The spread of information, and therefore misinformation, really took off with the invention of the printing press in 1493. This was the first of one-to-many communication on a larger scale, as opposed to one-to-one communication, and was followed only by more development of this one-to-many type of communication. Radio eventually came along, then television, then the internet and social media. When cholera was devastating people in the 1850s, the theory that it was waterborne, which we now know to be true, was circulating but not widely accepted. Physician John Snow even collected data to connect cholera deaths to a specific water source, but even this was ignored for a number of years. Until the waterborne theory was accepted, ineffective and even damaging treatments remained the stars of the show. Patients were put in isolation due to the belief that the disease was spread directly from others. Some people were told to avoid alcohol, while others were convinced that drinking brandy was the right move. There were many proponents of wearing woolen stockings to keep warm enough to avoid the disease. And of course, patients were bled with leeches because no 19th century disease escaped the leeches. During the 1918 flu pandemic, people somehow latched onto the idea that the virus could be defeated by whiskey and water. A good number of doctors were even writing prescriptions for it, especially since several states had prohibition laws in effect. In 1983, an article in a newspaper called The Patriot, citing an anonymous American scientist, falsely claimed that AIDS was a result of U.S. experiments to create biological weapons. As is often the case with misinformation, the story was spread far and wide by several sources in several different countries. There are also small but persistent pieces of health misinformation that have been clearly debunked, think colds and cold weather, that just won't go away. And, as we covered in our 2021 series on vaccines, also completed in part with funding from the NIHCM, vaccine misinformation was haunting us as far back as 1721. So, as you can see, misinformation has been an issue for longer than any of us have been alive. Situations that combine uncertainty, anxiety, and a lack of information, like what we see with a new disease outbreak, are prime breeding grounds for misinformation. Gathering information, even if it's false or unverifiable, eases tensions and creates a sense of community or shared understanding, both of which are attractive to humans. But if it seems like it's more of an issue now than ever, it's likely due to advances in the ways we share information. The internet has really blown all previous methods of sharing information right out of the water. The internet is the most efficient rumor mill in the history of rumor mills. Not only does the internet provide a much cheaper and more accessible way to spread information, it removes the confines of geography, meaning a piece of information now has the ability to spread far beyond the geographical location where it was created. And the number of people consuming such information is only growing, particularly on social media. According to one national survey from the Pew Research Center, 72% of American adults use social media for things like news content and information sharing. But what's wrong with widely available information? Well, nothing. We personally love making information more widely available. It's the whole reason this channel exists. But there are a few factors that put a damper on the thrill of widespread access to important information. While those 72% of American adults, and other adults across the globe, have access to both true and false information, the false information unfortunately spreads faster than the truth, making it more likely to be encountered. In the words of Jonathan Swift in the year 1710, falsehood flies, and the truth comes limping after. While it seems this has been true for a very long time, the sheer scale of the internet makes it an almost new kind of problem. Data from a 2018 study suggests that the top 1% of false information could reach up to 100,000 people in some cases, compared to true information that rarely reached more than 1,000 people in any case. Great, you say, so what do we do about it? The internet's here to stay. Well, if you so kindly join us next week, we'll attempt to figure it out together. Hey, if you enjoyed this episode, you'll enjoy this episode from a while back about disseminating your research. We'd appreciate it if you'd like this video, subscribe to the channel down below, and perhaps go on over to patreon.com/healthcaretriage, where you can help support the show, make it bigger and better. We'd like to especially thank our research associates, Joe Sevitz and Edward Lilliholm, and of course, our Surgeon Admiral, Sam.